So what I'll do is I'll just start talking and then we can get this session underway. So hi everyone, welcome to Studying Medicine. We have with us today Aman, who is a medical student at King's College London, and she's going to talk to you about all things to do with studying medicine and applying for medicine. Okay, great. So what I'm going to do is I'm going to hand over to Aman and we can get started.
Thank you. So while Connie is doing that, I will just introduce myself again. Yeah, so my name's Aman and I am in my 5th year of study at King's College London, but I'm a 4th year medical student. I'll explain why that is in just a second. Let me just share my screen. Connie, the share screen button's not coming up.
It should be along the bottom. Can you see it along?
Oh, it's just come up now.
The green one, yeah?
Yeah, sorry.
Okay, great. No worry.
Okay, so hopefully you can see my slides. So as Connie said, we're going to be talking about studying medicine today. My plan is to introduce myself a little bit about what I've been doing at medical school, where I am, and then obviously talk about how COVID has impacted the degree and specifically where I am in my study. Why I think we should study medicine, and this is kind of an accumulation of why I first chose to study medicine and what I've kind of gained from my 5 years of studying. What does the degree look like? So I will go through each year specifically. I'm hoping this will be really useful because I didn't really know what each year looked like before I started studying medicine, and now kind of as I'm near the end, I can hopefully give you an insight into what you actually learn and what you kind of build upon through each of the years. I'll then go through the application process. So I'm not sure if you're year 12s, year 13s, or what year we're targeting this towards, but I know some of you might have already applied if you're in year 13. So that won't be as relevant for you. But if you're in year 12 or below, hopefully that will be quite useful. And then I will take any questions. I will also take questions throughout. So if you do pop them into the Q&A or chat box, I'll try and answer them as we go through. But if there are any not relevant to the slide I'm talking about, I'll answer them at the end. So just a little bit then about where I am. So as Connie said, I'm at King's College London, and this is what my campus looks like. It's called Guy's Campus, and that's where I started my 1st year of study, which is pretty much where I was based all of 1st year. And then in my 2nd and 3rd year, I was also based at Guy's Campus, but I started doing a little bit more clinical work. So I was based at St. Thomas's Hospital, which is one of the central London hospitals near Westminster. In my 4th year of study, which is the year I just completed, I did an intercalated BSc in primary care. So I'll go into a little bit about what an intercalated BSc is later. But essentially, it's another degree that you can do as part of your medical degree where you do something that you're interested in. So I'm quite interested in primary care, which for those that don't know, it's kind of general practice and hospital work. Recently, I started my 5th year of study or my 4th year of medical school, and I've been based at University Hospital Lewisham, which is where I did a pediatrics rotation, so working with children, and I also did a mental health rotation there as well. And I'm going to be going to Swindon, so Great Western Hospital in January, to be doing emergency medicine and my last couple of blocks before I finish the degree. Whilst I've been at medical school, I've also been tutoring for MyTutor. So I tutor for medical topics, so things like interviews, UK CAT, and I also do GCSE chemistry and GCSE maths tutoring. I'm also president of KCL Open Mind Society. So what we do here is we go into schools and we teach about mental health. So specifically trying to reduce the stigma around mental health. So it's quite a prominent stigma. So we go in to about year 9, year 10 students and we do teaching. So that's a society that we do there. And then the final thing I've been doing, is prescribing research. So you may know now that research kind of is a big thing for medical students. And so I'm really interested in general practice and primary care. And one of the big things that general practitioners do is prescribe. So I look a lot into kind of prescribing and inappropriate prescribing and what we can do to improve prescribing. So I'm just going to answer a few of the questions we've got. So the entry requirements, I'm going to go through this later because it differs per university. I will tell you that specifically for King's College London, The grade requirements are A star AA. The UK CAT score that you need to get should be kind of in the 50th centile and above. And your GCSEs don't matter as much, but they are looking for pass grades in all the core subjects. Okay, so how has COVID-19 impacted my degree? So I'm sure a lot of you have had massive impacts from COVID-19 if you're at school or if you're in younger years. It's probably impacted every single one of us. So for me, I have been wearing PPE every single day whilst I've been in hospital, and you have to change out of PPE 3 or 4 times a day, so it can be quite difficult. But it has allowed me to see little kiddies like this, which I would say pediatrics has been my favorite block so far. I've loved kind of talking to kids all the way up from babies all the way to 15, 16-year-olds. I've also been able to take histories, which just means kind of actually talking to mental health patients, trying to understand how their mental health has changed and what we can do to help them. But of course, I've been using Microsoft Teams and Zoom to do teaching. So that's teaching delivered for me, so clinical skills teaching. And I've been doing virtual consultations over things like Zoom and Microsoft Teams as well. And this has kind of impacted all the years. So all the years are having a very similar situation in medical school at the moment. Year 1, which I'll go into in a bit more detail in a bit, is pretty much lecture based. So all of that has been almost online. But after that, in the clinical kind of years, so year 2 and beyond, we've kind of been doing a mix of virtual and in-person clinical teaching. So someone's asking, why do you keep going to different hospitals and universities? Will that happen to us too? So I'm still at the same university. I'm still at King's College London. It depends on the university that you're at, but yes, you do tend to rotate around hospitals. And the reason for that is that if you're a big medical year, so for example, at King's, we're 450 students in our year, they can't put you all into one hospital. So you move around, different hospitals have different specialties, and it's also good for you to kind of be integrated with different teams, and you learn a lot more by being at different hospitals. Someone's asking, what exams do you need for the university other than GCSE and A-levels for medicine? Okay, great. So yeah, so apart from GCSEs and A-levels, it depends which universities you apply to, but most of the universities want the UK CAT, or the UCAT now as it's called, which I'll go into in a little bit more detail in a bit, and the BMAT. So the BMAT universities are UCL, Brighton and Sussex, Cambridge, Oxford, Imperial, and there might be 1 or 2 more added on. I think Birmingham might also be a BMAT university now. Will you still need experience for medicine during COVID? So really good question. What I would say is if you can get the experience, definitely do. Experience goes a long way in writing your personal statement, and it also helps you to understand if medicine is the right degree for you. So I did some hospital experience just for a couple of days, and I was with diabetic patients. And then I also did care home experience, which is what a lot of medical students do. And I think it just shows you kind of the different aspects of medicine and what doctors actually do. So I really didn't appreciate that before starting. And you'll see that actually, although everyone says they want to do medicine to kind of help patients, doctors don't always help patients. A lot of the time, it's the nurses that are communicating with patients and being there for them. It's the doctors that are more involved with the scientific side and diagnosing and managing patients. What is the BMAT? I will go through that in a second. Does that mean you'd have to do BMAT and UCAT to get into those schools? So good question. So for the universities I mentioned that take BMAT, you don't need to do UK CAT for them. But if you're planning to apply for UCAT and BMAT unis, which is what I did, you have to do both exams. Is experience required this year? To the person that asked me that, if you tell me what year you're in, I can give you a little bit more guidance with that. Is a personal statement and a CV the same? No, so a CV is more of a kind of list of what you've done, kind of experience-wise, work experience, your achievements, your GCSEs and A-levels and things like that. Whereas a personal statement is more about why you want to study medicine and why the university should give you a place or give you an interview. Someone's asked, how did I get medical experience? So it's really, really tough. That's what I would say. If you know kind of doctors, which often we don't know doctors, but if you do, I would definitely try and get in contact with them. Also, a lot of GP surgeries now have online admin kind of areas where you can send emails to the practice manager and you can ask to experience. That's one of the ways I got experience, and I would definitely recommend doing that. It's just an email to the practice manager. You can send the same one to multiple practice managers and see, and hopefully one of them will get back to you just to kind of sit in with the GP. Someone's asking, I'm not very good at communicating and I'm very shy. Is medicine still the right option for me? Okay, so that is a really, really good question. And I can tell you that I was really, really shy before I started medicine. And I really struggled in my interviews because I was so shy. I wasn't good at communicating at all. But since joining medical school, my confidence has increased so much. And the reason I chose to do medicine, even though I was shy and not very good at communicating, was because I genuinely wanted to kind of be involved with patients. But most importantly, I wanted to be there to kind of be there throughout the whole of their life. So I want to be a GP, and as a GP, you're a family doctor, so you tend to see patients over multiple years. And for me, that's what mattered. So even if you're not good at communicating, you can always improve those skills. It's about why you want to do medicine and whether you think that's enough of a push to do the medical degree. Okay, I'm going to move on just because there's a lot of questions. I'll try and answer some more in a few more slides. So why study medicine then? So some of these are kind of what I knew before. Some of them are what I've gained throughout my medical degree. So to make a positive impact on someone's life. Now, what I mean by this is not necessarily curing someone. It's not kind of giving them a drug. It's actually just sometimes talking to patients. It can be giving a drug, definitely. It can also being there in their last moments of life. So what we call palliative care. It can also be talking to the patient's family. So making a positive impact on someone's life means so many things. And in medicine, that it really is a range. And it's one of the main reasons I wanted to study medicine. And if you think that you want to make a positive impact on someone's life, specifically medically, then I would definitely recommend medicine. To be intellectually stimulated. And this is really true. So the medical degree is hard. And every single day is different, not only when you're on a clinical placement, but also kind of in your first couple of years of study. Every day is completely different and every day is difficult. So you will be intellectually stimulated, and it's important that you think you can keep up with it. And I think we all can. I definitely think if you're motivated, you'll get through the degree. To be a detective. So this is also really fun in medicine when you've got a patient that's presenting with lots of different symptoms, and you have to work out what is causing that, what is causing all those symptoms. So you are a bit of a detective. You have to put the patterns together. So one of the reasons we do the UCAT exam is actually to see if you can detect patterns, because as a doctor, that's what we do. We detect patterns in patients to then try and treat them if we can. To learn about the intricacies of the human body. So I'm sure a lot of you might put that in your personal statement, and it really is very true. So all the way from doing dissection, which you tend to do in your earlier years, where you kind of look at the human body, you dissect it, look at all the organs, and you learn about how those organs interact with each other, how they can go wrong, so how there can be pathology there, and then what you can do to kind of get those organs working again. To promote disease prevention. So this is something I didn't know before I joined medicine. And what this means is a lot of the time we want to stop someone getting a disease before they get it. So promoting disease prevention basically means, for example, stopping smokers smoking to prevent them getting lung cancer, trying to get obese people to lose weight to stop them then getting multiple cancers, so stomach cancer, pancreatic cancer, colon cancers, lots of different cancers involved. And it's not just cancer. There's things like, so for example, smoking can cause something called esophageal candidiasis, which essentially is a disease of your gullet. And you want to stop people getting these diseases if you can. So it's about promoting good health. To apply basic scientific principles to a disease process. So I'm sure a lot of you here like science if you want to study medicine. And actually you do need to know those scientific principles. So how the heart works, how we respire. And it's those that then you can use to understand why a disease is presenting the way it is. So why does the heart stop working when, for example, you get a heart attack? What's happening? It's one of the blood vessels blocking. And then what happens? You don't get blood going to the heart, you don't get blood going to the rest of the body, and that causes pain. So it's about understanding those basic scientific principles and then applying it to the disease process. To work alone and as part of a team. So if you like working alone, that's also good in medicine. You don't have to work as part of a team, but there are going to be times when you need to work as part of a team. So in hospitals, they tend to work in part of a team, whereas in GPs and when you're running clinics, you tend to work alone. So you tend to do a bit of both, especially through medical school, and it's important to be comfortable doing both. but obviously there is probably going to be one that you're more comfortable with. So for me, I like working as part of a team and I like working alone. If I had to choose, I'd probably choose working as a team so that the pressure is a little bit off me. But some people do like working alone, and that's absolutely fine. But it's important that you should know that you will be doing both. To be a generalist or a specialist. So a generalist is almost like a GP. So they tend to know a little bit about everything. So they can treat lots of different presentations. Whereas specialists are things like, for example, cardiologists, so doctors that work on the heart and really only see patients that have heart conditions. And medicine is great in that there are so many specialties. So whatever you're interested in, you can find something. So if you're interested in the eye, you can go into optics and ophthalmology. If you're interested in the liver, you can go into hepatology. So there's lots of different specialties. And that's something that you learn through medical school. You see lots of different specialties and you see what interests you. I'm going to answer a few more questions because I'm aware we've got lots more questions coming in. Do you need experience as a year 11? So what I would say is if you can get experience, definitely get it. The earlier you can get it, the more it will help you, just because you can start doing more. So obviously this year there's COVID, it's really difficult. But if you can get it this year, maybe doing kind of online virtual consultations with general practitioners, going into care homes. So care homes are still open and a lot of them have rapid COVID tests now. So if you can go in, do a rapid COVID test and then kind of talk to the residents of the care home, that will be really beneficial for you. The other thing you can do is a lot of hospitals have kind of internships for a week. I don't know if they're still running because of COVID, but maybe not this year, and maybe next summer if you're in year 11. I definitely look into that. Those hospital internships tend to be very, very good. Am I a doctor? No, I'm nearly there. I'm about a year away from qualifying. Which field of medicine am I in? So I'm still a student, but I'm hoping to go into primary care. What do you do if you want to be a surgeon? Do you do some additional degree to the medical degree? No, you still do the main medical degree. After medicine, every single doctor in the UK has to then do foundation training, which is what we call FY1 and FY2, so foundation year 1 and foundation year 2. After that, you choose the specialty that you want to go into. So if you want to be a surgeon, you'll start surgical training. And then through that, you do general surgery, and then you get more and more specialized depending on what type of surgery you want to do. And then, for example, if you want to go just be a general doctor at the hospital, so what we call medical doctors, you can then go and do general training. If you want to be a GP, you go and do GP training. So it's after FY1 and 2 that you then choose which specialty you want to go into. And often if you don't know, you can just do an extra year where you're called an FY3, where you're still choosing and you kind of work as a locum doctor. Someone saying, I'm very torn between medicine and veterinary medicine. Do you know if these two routes are similar? They are very similar. So one of my closest friends is doing veterinary medicine. And essentially the way the years work is very similar. So the first year tends to be very kind of lecture based. And then after that, it's very clinical. So you're working with animals. It's a 5-year degree. They tend to want the BMAT and not the UK CAT, so veterinary medical schools, although not all the veterinary medical schools want the BMAT. Some of them just want kind of personal statement. So definitely look into it and kind of see what are you leaning towards in that. Do you want to kind of help people? Do you want to be more there for animals? It's not a decision to take lightly. I definitely try and write a pros and cons list to help you to decide. Okay, I've got lots more questions, so I'll answer one more and then I'll move on. So I'm in year 11 and I'm struggling to decide what subjects to take for A-level. I want to do something in medicine. However, I don't like, and I don't think I will get the grades in chemistry. What are your suggestions? Okay, so really good question. A lot of people absolutely hate chemistry. I liked chemistry, so I did chemistry, but a lot of my friends who are studying medicine did not do chemistry. You can just do biology and maths. It will limit your medical schools because almost all medical schools want chemistry, but there are a couple of medical schools, especially up north, that will just take biology and maths. So what I would do is I'm going to show you in a couple of slides a great website to use to compare medical schools. Have a look at those, see which ones don't require chemistry. And if there are enough there that interest you, then go ahead and do biology, maths, and whichever other subjects they want. If you want to kind of have be able to kind of apply to all the universities, I would definitely recommend doing chemistry, and actually you don't need to do biology. Okay, so I'm going to move on. So what does the degree look like? So I'll start with year 1. So this is where it's mostly biomedical science. So what I mean by this is it's pretty much lecture based. So we do lectures and seminars focused on biomedical science. So it builds upon A-level biology. So it's things like how the heart works, how the lungs work. And also then we do anatomy, which is really interesting. So it's about learning all the blood vessels, all the nerves, and essentially using dissection skills to build upon what you've learned in anatomy. So I'm just going to talk a little bit about the difference between dissection and prosection. So if you're applying for medical school or have already applied, you might have seen that some universities offer dissection and some universities offer prosection. So dissection is what is offered at King's and a lot of the London universities. And that basically means you have a whole body to work with. So you will then kind of I'll try and not put it in a crude way, but cut up the body to have a look at, for example, the stomach, the liver, the lungs, the heart, all the organs. Whereas prosection is usually where you're given a heart to then dissect. So you won't be given the whole body to then take the heart out of to then dissect. Prosection, you'll just be given the heart or the lungs or an arm, for example. So statistics, for those of you doing maths, you might not, or not doing maths, you might not like the sound of statistics, but we do statistics because, as you might have remembered me mentioning at the beginning, research is an important part of medical school and medicine in general. You know, medicine doesn't advance without research. And statistics forms a big part of that. So you will do basic statistical science, and I'm talking really basic, below kind of A-level maths. So I did A-level maths. It's really very simple statistics, but it's nice to keep that going if you've done GCSE A-level maths, and it's actually quite interesting as well. So to put that towards research. And then philosophy, again, some of you might not like the sounds of that. I definitely didn't like the sounds of that, but it's actually quite interesting. It's something you can do differently to kind of understand why decisions are made, and for you to kind of also write essays on. So we do write essays in medical school. Again, that was not one of the things that I liked. I absolutely hate writing essays. But it is something we have to know how to do, because at the end of the day, if you go into doing research and things, you're going to need to write essays, and things like a logbook that we all have, we kind of have to write reflective essays. Okay, so I'll take a few more questions now. So no one really gives experience this year. I've tried care homes and hospitals, but they are not running. Yeah, I can appreciate it's really difficult because of COVID. And what I would say is then, if you live near any medical schools, I would try contacting them, because sometimes they then have kind of training days. So I know Oxford Medical School definitely run a 3-day training days in summer, which I would have a look at. Again, I don't know if it's running because of COVID, but I would say that the medical schools are going to be understanding if you haven't had any experience. As long as you've tried and you can talk about that in an interview, I think it will be fine. How long does medical training take? Okay, so it's a very good question. So the medical school degree is either 5 or 6 years, and that depends on whether you do an intercalated degree or not. So I've done an intercalated degree, so my degree is 6 years. But pretty much all medical schools it's 5 years of medical training. And then after that, you do your foundation years, and then you go into specialty training. Do you get paid during your foundation training? Yes, you do. How many years would it be to be specialized in a field? So it depends on which field you go into. So a lot of the specializations take 8 years, some of them take 5, and some of them take 3. So general practice is 3 years. So after you've done your foundation years 1 and 2, you then do 3 years of general practice training. If you want to be a dermatologist, for example, it's 8 years. So dermatology is skin specialists. If you want to be a psychiatrist, so mental health doctor, it's 6 years. It depends on which field you want to go into. I'm a student that gets 7s in biochem and maths at GCSE right now. Is it possible for me to get into medicine? Yes, definitely. You just need to pass your GCSEs. Obviously, it's better to get better grades, but passing is enough. So 7s is amazing. So well done. Do you have to take maths as an A level in order to study medicine? No, you do not. I have lots of friends that did biology, chemistry, and English. I myself studied biology, chemistry, maths, and Latin. I would definitely recommend not taking a 4th subject. It's very difficult, and doing 3 is plenty enough. So if you don't want to do a 4th subject, you do not have to. Please don't feel forced to. So the person that's asking me about 4th, no, you don't need to. How long does it take to become a fully qualified doctor surgeon? Okay, so you are fully qualified from the moment you step out of medical school. so 6 years. But if you want to be a surgeon, obviously you'll be a general surgeon from the moment you start surgical training. So that would then take 8 years. But then to be a kind of a fully qualified surgeon or a consultant, it will take however many years your training is until you get to the end, basically. What happens if you fail medical school? Okay, so medical school, people don't tend to fail. If you are going to fail, most people fail in their first year, and then you get a chance to retake the exams. And if you then fail after retaking the exams, which does happen, and it might just be because of extenuating circumstances, you can then choose to retake the year, although some medical schools do kick you out. So what I would say is, I said that medical school is hard, but I'm going to explain what I mean by hard in a couple of slides, because it's maybe not what you think when I say it's difficult. I've got 9s and 8s and everything, but got a 5 in English at GCSE. Will this affect you when applying for medicine? No, I think a 5 is a pass, so you should be fine. Okay, what does the pay range start at for medicine? Okay, so pay range for medicine, as an FY1, you tend to kind of earn about £25,000. In FY2, you go up to about 28, and then after that, it goes up massively. So when you start training, it will go up to about 50, 60,000 pounds. And then at consultant level, you can be earning anywhere between 100 to 200,000 pounds a year. Although there's not as much money as there probably was many years ago, we're still paid well. But I would say don't go into medicine for the money. It's a lot of people now do it because they actually want to do it. The hours are much harder than they used to be. The work is much harder than it used to be. And there's a lot less of us. So that just means that you have a lot more of a workload. Is it useful to have a language as an A level? I'm going to take Spanish. Yes, definitely. If you want to do Spanish, definitely do it. What is the marking scheme, as I'm used to percentages? I'm not sure what you mean by that. I want to be a neuroscientist. Is being a neurosurgeon the same? No. So a neuroscientist does kind of research on the brain and is interested in how the brain works. A neurosurgeon will do operations on the brain to fix pathology. So if there's a cancer of the brain, they'll remove that cancer. If there's a blood clot in the brain, they'll remove the blood clot. Do you get paid while at university and med school? I wish. No, we do not. How competitive is medicine? Okay, it depends on which medical school, but it is very competitive. Okay, right. I'm now going to move on to year 2 of medical school. So introduction to disease. So I enjoyed year 1, but not as much as kind of the following years, because year 1 was very science-based. For me, I like the clinical side of things. So in year 2, I had my first clinical exposure. So I was based a GP practice once a week, and I was also put in a hospital once a week. So I had 2 days of clinical experience every week. I had a student selected component. So most medical schools will do this, where you basically get to choose to do something alongside the medical degree. So you can either do a language, you can do another philosophy component, you can do a research component. So I chose to do a teaching component because I'm quite interested in teaching. You do still have lectures, but they're more focused on basic pathophysiology. So what this means is disease, basically, and how disease works. So in year 1, you'll look at how the body works, how the body, kind of what a normal functioning body will do, what all the organs do, and we'll have dissect all those organs. In year 2, you'll look at how those organs can go wrong and what's actually happening. So that's what pathophysiology means. It means what is happening to cause that disease. And then you'll start clinical skills training. So in year 2, it's things like learning how to take a blood pressure, how to take blood, how to give flu vaccinations, things like that. It's really fun. Most medical schools have clinical skills labs, so you'll work on mannequins, but you will also do it in person as well. So year 3, this is usually diagnosing common conditions. So it's called diagnostics year because by this stage, you've kind of learned about most common diseases and you should know how to diagnose them. So you get more clinical exposure. So I had 3 days a week. The lectures are, as I said, focusing on diagnosing common conditions. So you've learned about the body already. You've learned how the body works. You've learned how conditions can arise. And now it's about putting symptoms together to become that detective and diagnose a condition. You get more clinical skills practice. So this might be in year 3, we learned how to put catheters in. So a catheter is essentially a tube that goes into the bladder to allow urine to come out. So for patients that can't urinate on their own, so they're incontinent. Again, it's about building upon the skills you've already done. So maybe now you'll take blood in person. We also learn how to put cannulas in. So it's building, hopefully you can see through this that you're building upon what you've done in previous years. And then there's a research component. So at this stage now, I'm going to talk a little bit about exams, because by year 3, you will have done quite a few exams. So in year 1, the exams that you tend to do will be based on your lectures. So they'll just be kind of basic science exams. And most medical schools do something called single best answer papers, which basically means multiple choice. The difference between multiple choice and single best answer is that you may have multiple correct answers, but you have to choose the best correct answer, which does make it difficult, but you kind of get used to it. So you'll do a couple of exams over the year, and then usually it's the last exam that counts the most. Some medical schools will do that you have an exam at the end of each topic. So for example, if you learn about the heart, you'll have an exam after the heart, and some medical schools do an overall exam at the end. In year 2, again, you have the same type of exam, single best answers. Some medical schools, I should say, do longer answers. So Imperial, for example, Oxford and Cambridge will do essay-based exams. You'll have short answer questions, long answer questions, instead of just single best answer questions. And you will also do something called an OSCE. So for an OSCE is a clinical exam. So this is where you actually have to talk to patients and do clinical exams on them, maybe take their blood pressure, take blood from a mannequin, things like that, and you're assessed based on your clinical skills, so how good you are at communicating. So someone asked me before, does it matter if you can't communicate? It doesn't, because you will learn this as you're going through. You will have multiple communication kind of skills workshops where you learn to build upon how to kind of show empathy, how to communicate with patients, difficult patients. It's not about changing yourself, it's about improving your communication skills. And then in year 3, again, you still have multiple choice or single best answer exams and another OSCE, which will tend to be longer. Again, this will be about diagnosing patients, because that's kind of the running theme of year 3. Okay, so I will take more questions now. What things stand out on a CV? So you don't need to write a CV for medical school. Would you recommend taking an exchange year? Okay, so an exchange year, I'm not sure what you mean by that. If you're planning on doing medical school in a different country, I would definitely look at whether you'll be able to practice in the UK. If you're talking about doing a gap year and going abroad, if you want to do a gap year, I would definitely do that. A lot of my friends did that and they really enjoyed it. I did a 2-week kind of exchange in India, and I did some medical training there. There's lots of kind of things where you can go abroad and you can do some training, and I got a lot of experience there as well, because they're more likely to let you go in hospitals and things. In the UK, it's a bit more difficult to get into hospitals, but abroad, they're more likely to let you in. Obviously, COVID's not great at the moment, so that's probably not as likely, but next year, if you want to go abroad, try and do that if you can't get experience here. Okay, what is the difference between working in a private practice and the NHS? So to work in a private practice, you still have to be an NHS doctor. Otherwise, you can never work in the NHS. But essentially, private practices are things like Bupa, Babylon. These are all kind of private companies that still deliver medical care, but it's mainly to businesses where they've given kind of their employees free medical cover. And so they tend to go private because you'll get operations and scans done more quickly than you would in the NHS. Okay, what's the best and highly skilled medical school? The answer to that is it depends on what you're looking for. So if you're looking for a research-based medical school, then Oxford, Cambridge, UCL, Imperial. If you're looking for clinical skills-based medical school, so if you want to be more of a clinical doctor, London unis. If you're looking for just an overall good medical school, then it's pretty much all of them, because all of the medical schools in the UK are amazing. What I would say is it doesn't matter where you graduate from, you will still be an exceptional doctor. You will not be disadvantaged by where you graduate from. Compared to other degrees, it does not matter. What matters is that you get the MBBS at the end, so the degree. Birmingham University, yes, it's competitive. I applied there. Would the training to be a surgeon be additional to specialist training? No, so you train, so after your foundation years 1 and 2, you then choose to do surgeon or surgery training. So you join the specialist program for surgery. How do you take notes in lectures? That's a great question. So I would actually say that I developed this skill kind of over my first year. So in my first year, I started by handwriting all my notes, which took a long time. It was taking me about 4 hours per lecture, which I didn't have the time for. We had over 200 lectures in year one. So I learned that the best way for me to kind of cut my time, but also continue revising and learning as I'm going along, was to annotate lecture slides. So most universities will give out PowerPoint slides or put them online. So I used to print them in year one, and I would annotate them as the lecturer was talking. And that was a much quicker way for me to kind of get my notes done. And also all our lectures were recorded, so I could rewatch the lectures afterwards. Apparently you dissect dead bodies, is that true? Yeah, so you can't dissect a live body because technically that's surgery if you're cutting up a live body. Dissection is always of dead bodies, and I should say that it's quite a new experience. It's a difficult experience, and it's something that you get used to. So it can be difficult being in a dissection room just because you're all surrounded by a lot of dead bodies, but you kind of you get used to it. And also if you don't like being in there, then you can leave, and there's a lot of support around that as well, because people do realize that it's not an easy experience, but you do learn a lot, and the bodies that are there wanted to be there, so they've donated their bodies to science. So we only dissect bodies that have obviously said that they want their bodies to be dissected for science. Okay, is it true that the better uni you go to, the better hospital or degree pay you get? No, that is not true at all. Okay, how is the timetable there? Do you have 5 lessons every day? Okay, so it's not quite like school. We don't have lessons. So in year one, you will have pretty much lectures 9 till 5 every day of the week bar Wednesdays. So Wednesdays in every medical school is sports day. So you tend to have lectures in the morning on a Wednesday, and then in Wednesday afternoon, you're allowed to go and do sports. So you're off. But yeah, usually lectures or seminars, clinical skills, 9 to 5 every day of the week in year one. Year two, you'll have that a couple of days of the week, and then the other days you'll be either in hospital or GP practices. Same with year three. When can you do abroad training? Okay, good. I'm going to come to that in a second. I will talk about the elective. I preferred King's, that's why I chose King's College London. Is it true that the better uni, no, you've already asked me that. Okay, great. I'm just going to ask anyone asking me questions, can you please put them in the Q&A instead of the chat box, just because it's easier for me to just read one area, but it's fine if you can't. Do you have to do maths A-level to do medicine? No, I think I've already answered that. Okay, I've been quite squeamish my entire life, and I'm not sure if I can handle medical school. Do you think that I would get used to it over time, or is it a bad decision? Okay, it depends what you mean by squeamish. So when I was doing experience in hospital in the UK, I saw a live birth, and I actually passed out first time. And I'm not embarrassed to say that, because a lot of people do pass out by seeing the blood. So what I would say is a lot of people are squeamish, but you get used to it. And I would say that it depends whether you think that other things matter more to you. So for me, I know I'm not a big fan of surgery. I'm not a big fan of like seeing gushing blood. So I don't want to do surgery. I'd rather be a general practitioner. I prefer talking to patients. And that's why I'm more kind of interested in general practice, psychiatry, teaching, and less so in surgery. And that's why there are so many different types of doctors, because surgeons aren't necessarily interested in talking to patients. And that's why surgeons are notoriously known for having bad communication. So you have to play with your strengths. Obviously, you are still going to have to do some things in hospital as part of your training. So it's whether you can get over it. But I would definitely say you will get over it. I've not passed out since. And so it's, as I said, it's about what you think it matters to you. Okay, did you do revision of biology chemistry in the summer before attending medical school? No, that summer should be a break for you. That was my one and only break I had before medical school. Since then, every summer has been really busy. So I would definitely take that summer as a break. Someone saying Medic Mentor is really helpful and it has some virtual work experience. Great, thank you for that. Is it true that if you do worse in your medical school exams, you get less choice about where you do your placements? I'm going to talk about this in a second, but yes. How many years would it take to become a psychiatrist? So 5 or 6 years of medical school, depending on whether you choose to do an intercalated degree, 2 years of foundation training, and then 6 years of psychiatry training. To be fair, I don't think most people enjoy doing surgery or watching it. Yet that's why we have a few surgeons, a few general practitioners, and lots of other specialties. Can you be a surgeon and be a normal doctor consultant? So surgeons still hold clinics. So for example, surgeons that specialize in, for example, cardiology, they will still hold heart clinics where they see patients with heart conditions that might need surgery. So they still hold clinics. So it's almost like a GP practice, but specifically for patients with heart conditions. Okay, let's move on to year 4 because I am conscious of time. So year 4 is usually your intercalation year, which is something that some medical schools, for some medical schools it's compulsory, and for some medical schools you choose whether you want to intercalate. So for King's, when I joined, it was not compulsory and you chose, so you opted in. But now it is compulsory at King's. It's compulsory at Oxford, Cambridge, most London medical schools, so Imperial, UCL, King's, and other medical schools, it's not compulsory at. So when you're choosing whether to do an intercalation, it's about whether there's something else that you're interested in. And you can choose to do a BSc or an MSci. So I chose to do a BSc in primary care, and an MSci is a master's degree. They both kind of count the same. It's just about doing another degree if you want to and what you're interested in. It is heavily research-based. So this is where I did a lot of my prescribing research. And you do kind of focus on research. So if you're thinking about doing something called an academic foundation program, so when I mentioned foundation program training, most doctors will go in and do the normal foundation program. But if you're interested in research, you can do something called the academic foundation program, where you do a research module as part of your training. It is the chance to go to another university. So I chose to stay at King's, but you can go to other universities because a lot of the universities offer intercalated degrees. It is, when you do an intercalation, it's like doing the 3rd year of a 3-year BSc degree. So if you chose to intercalate in, for example, philosophy, you would be doing the 3rd year of a normal BSc philosophy degree. Same for psychology, same for anatomy, but you won't be necessarily with those students. You are for some of the modules, but not always. Now, it is the chance for a break. So by the time you get to year 4, you've completed over half of your medical degree, you've done 3 years, and a lot of people at this stage want a break. For some people, the intercalation they choose is easier than their medical degree. For some people, it's harder than their medical degree. So for example, doing a master's can be really difficult. So that is a lot harder than the medical degree, whereas doing an intercalated BSc is about the same, or it can be less difficult. So it is a chance for break because you're not in every single day, you're not seeing patients, but it depends on which intercalation you do. So as I said, I intercalated in primary care. So for me, I was seeing patients. I was actually at a GP practice once a week, and I was doing clinical skills training because that's what I'm interested in. I wasn't kind of interested that much in research. So I did a little bit of research and a little bit of clinical skills training. Is the BSc beneficial for future opportunities? Yes, it is. So for example, if you want to do surgery, having an anatomical or anatomy BSc can be really good because it shows that you've got advanced anatomy knowledge, which surgeons need because they're cutting up the body. They need to know exactly what they're cutting through when they're doing surgery. Did you know a lot about the history of the NHS healthcare in general for your interview? Yes. So in my interviews, I got asked a lot about kind of Mid Staffordshire Hospital and what happened there, a bit about how the NHS was formed. It does depend on medical school though. So if you've got MMI interviews, which are the multiple mini interviews, then it's not as important because they're more communication based and skills based. Whereas if you've got panel interviews, you're more likely to be asked about your personal statement, about kind of, the NHS and different things that are going on in healthcare at the moment. Apparently in some schools, the years go up to year 14. Does it mean you could stay an extra year? Not sure, sorry. How many choices do you get? So you get 4 medical schools and then 1 extra option, which is not a medical school, you have to do another degree. What does intercalation mean? So intercalation basically means that you do another degree between or in between your medical degree. So it's intercalated in there. Can you do a random degree in an intercalation such as music? Yes. Can you do a BSc or MSci in maths while studying medicine? Yep, so there are statistical based ones. Do you recommend the 3-day Society of Academic Primary Care? Yes, I'm actually presenting in the Society of Academic Primary Care scientific meeting. Yes, I would definitely recommend it. It's really interesting. Why do you need to know about the history of the NHS? Just because the way the NHS is now is very different to how it was when it was first formed. So knowing a little bit about how it's got to where it is can be really good for you to kind of understand where it might be going in the future. Does the BSc help you in being chosen for certain specialties? Yes, it does. So for some competitive specialties, part of the form when you're applying asks if you've done another degree. Okay, year 5, managing common conditions. So this is where I am now. So we have minimal lectures. We have full clinical exposure. So I am in 4 days a week. The only day I'm not in is Wednesday. And as I said, that's because it's sports day in the afternoon. So in the mornings, we do another project, which is quality improvement. So we are still technically in a hospital. We're doing a quality improvement project. And we have something called portfolios, so sign-offs. So this is where we actually have to do skills in the hospital and get them signed off to show that we are learning as we're in hospital. So for example, one of the sign-offs I got most recently was to do a female catheter, so putting a tube into the bladder in a female patient. I've also taken an arterial blood gas, so putting an injection into a needle into an artery to take blood. So there's lots of different skills and taking talking to patients and things like that. You have to get signed off. Okay, the final year of medical school. So it is full clinical exposure. So again, just like my year right now is 4 days, sorry. And then Wednesday morning, you do another project. Usually it's global health. So it's thinking about the health across the world. Thinking about infections and different types of infections. So for example, malaria isn't really strife in the UK, but places like in continents like Africa, it is. Knowing about dengue, yellow fever, things like that, which you can't really get in the UK, you get them from abroad, are things that you learn about. You make your applications for foundation year. So for this, you will rate all the kind of hospitals, but when I say hospitals, it's deaneries. So for example, the Oxford Deanery covers all of Berkshire, Oxfordshire, and then London's split up into 4 deaneries. So Southwest, North, Southwest and East, sorry. And then there are some like South Thames. So you rank all the deaneries based on where you want to go. And it's also based on how well you've done at medical school as to whether you get your first choice. You also do something called the SJT. So for those of you who have done the UCAT or are planning to do the UCAT, you'll know that part of the UCAT is the situational judgment component. So we do a situational judgment test in final year as well. And this is longer and it's more about kind of making decisions, making the best decision. So it's like the UCAT, but building upon it. We get our pre-registration GMC number. So this is basically the number that you give to prove that you're a doctor. And we do an elective. So someone asked, when do you go abroad? So it's usually in your final year when you are allowed to go abroad for a couple of months and do training in a different hospital. So unfortunately for us, we're not going to be allowed to go abroad because of COVID. But I was planning to go to Canada to do family practice there because that's what I'm interested in. But if you guys do medicine, you should be able to go. So hopefully COVID will be done by then. I'll take a few more questions before I move on to the application process. Are extracurricular activities very important and beneficial? Not really. So it depends where you apply. So at school, I didn't really have many extracurricular activities. I used to dance and that was about it. And I did a few scientific things. So I think I was part of the chemistry Olympiad and the maths Olympiad. Which I talked a little bit about in my personal statement, and then my teachers also mentioned it in their statement. But what I would say is focus more on what's going to help you as a medical student rather than things that you think will look good. So obviously, if you've learned a musical instrument and you think that's going to be helpful, then write about it. But saying that you've learned clarinet, piano, and all of this, how is that actually going to help you for medical school? Because the personal statement is all about you kind of pulling those skills together and saying, well, actually, this is going to help me in this way, or I want to learn more about this, etc. What happens if you don't get into your desired uni at first? Would you apply to more unis, and what happens if you don't get into these as well? Okay, so a lot of people don't get into medical school, and that can be really hard. What I would say is apply to a range of medical schools. So apply to one that is your first choice. So King's was my first choice. I didn't want to go to Oxford, Cambridge, so I didn't apply there. And then I applied, so I probably should say the unis I applied to were King's College, Birmingham, Southampton, and UCL. So as I said, King's College was my first choice, and I applied to kind of a range. So Southampton was a little bit more on the kind of easier to get into. King's and UCL were the harder ones, and then Birmingham was kind of mid. So I would say apply, kind of have one or two that you think might be harder to get into, one that's maybe slightly easier, and one that's about mid, so that you've got, don't just apply to like all BMAT unis that are harder to get into, for example. Is medical school significantly more stressful than year 13? No, year 13 was by far the most stressful year of my life. Medical school is much, much easier. Do you study medicine and the intercalation at the same time? No, so when you intercalate, you are not studying medicine anymore for 1 year. Can you choose to skip to the next year? Yes, not all medical schools require you to do a BSc. As I said, it's mainly the London unis and Oxford and Cambridge that it's compulsory to do a BSc. I'm not good at sports, so should I not do medicine? I'm not good at sports either. You don't need to be good at sports to do medicine. When I say sports afternoon on a Wednesday afternoon, what I mean by that is it's a chance for you to do something outside of medicine if you want to. So you can go and do societies and things. So for me, this is where I was doing open minds training. So where I went into schools to teach about mental health. Is sports day in every university and in every course? Yes. So it's not a day as such, but there's competitions between universities, between societies. Okay, fine. Let's move on because I'm very aware that we are running out of time. So the application process then. So once you've decided that you want to study medicine, you then need to research and visit universities. And I would say this is the most important part, and it's something that I didn't do very well. You then need to write your personal statement. I'm going to go into these in a little bit more detail in just a second. You need to do your entrance exams. You need to submit your UCAS application. So usually you do the UCAT before you submit UCAS, and the BMAT's done after. You then do your interviews. All the universities require interviews apart from Edinburgh. And then hopefully you get some offers. So research and visit universities. Okay, so over here on the right-hand side, that is a screenshot from the Medic portal, which if you've not heard of, I would definitely go and visit. It's an excellent website where you can actually put in and compare lots of different universities. So these are the 4 universities I applied to. And on there, it shows you kind of, I've not kind of given you the whole table there because I couldn't show you the whole thing, but it tells you what's compulsory, what's not. So for example, this is an older screenshot, but the intercalated BSc is only compulsory at UCL. It is now compulsory at King's, but as I said, this has not been updated. It tells you how many participants and how many applications. So for example, they have 6,000 applications and 1,300 are interviewed, and there are 400 places. And you can compare across all the universities. And this is definitely something I would do. It tells you the admission requirements or the entrance requirements. And it also shows you things like how the course is structured. So integrated basically means doing clinical and lectures at the same time, whereas Oxford and Cambridge are not integrated. Your first 3 years at those will be very lecture-based, and then you go into clinics. So it's kind of separated. There are spiral curriculums, which means that you kind of keep coming back to things. And then there's also a thing about doing PBL, which is problem-based learning, which if you don't know what that is, I definitely research it. Essentially, it means that at medical school, in some of your seminars, you'll learn about diseases in group work, which I didn't like the sound of, so I didn't apply to any problem-based learning universities, although I think Southampton is now a problem-based learning university. So this is why I would definitely recommend the Medic portal, so to kind of compare all the universities. YouTube. There are so many YouTube videos from medical students at different universities where they actually give realistic reviews of each of their years, of the hospitals, of the universities. So I would definitely recommend doing that, having a listen and a look at what the campuses look like, especially with COVID. I think that can be really helpful. Virtual open days, unfortunately, I think a lot of the universities are offering virtual open days, which just isn't the same, but definitely still go along to them and try and visit as many as possible. So the mistake I made was I didn't actually go and see all the universities. I applied to Birmingham, didn't go and see it. I applied to Southampton and didn't go and see it. I actually only went and saw King's and UCL, and it's because I fell in love with King's, which was a stupid thing to do because you should definitely go and see as many universities as possible. I was fortunate that I got a place at King's, but if I hadn't got a place at King's, I wouldn't have even known what any of these universities were like. So I would definitely go and visit those universities, even if it's virtually on YouTube, however you can. Please go and visit universities that you want to apply to. Even if there are ones that you don't want to apply to, go and see them. You can learn a lot just by talking to the lecturers there. And this is a real campus tour at King's College London. Okay, so writing your personal statement. The student room is excellent. I'm sure a lot of you have heard of that. There are lots of exemplar ones on there. You can also use MyTutor. So there are lots of tutors that will help you with your personal statement. They won't write your personal statement for you. But in the past, what I've done for students is they'll give me their personal statement and I'll help them to just kind of refine it a little bit. So kind of maybe if they've got a point about how they did this kind of experience, I'll help them to maybe think about what they actually learned in that experience that's relevant to medicine. So it's about talking through your personal statement with someone else and trying to understand what might make it better. Definitely use your teachers. They've been helping with personal statements for years, so they know a lot. And compare with friends, especially friends that might be also applying for medicine or dentistry or whichever course you're choosing to do. It can be really useful to get ideas from other people. Okay, I will just take some more questions now. Yeah, so you apply to 4 universities and then 1 non-medical university. How do you remember all the dense content throughout the years that you learned during medical school? That's a really good question. You actually build upon it. So when I was going through each of the years, I talked about how first year was more about how the body works. Second year is about how the body can go wrong. Third year is about then diagnosing those wrong conditions or where the organs are failing. And then fourth and fifth year of medical school is actually about managing those conditions. And you're just building on it all the time. So for me, I've got lecture notes from year 1 where I learned how the heart works. In year 2, I've then got a lecture on a myocardial infarction, which is the correct or scientific name for a heart attack. And then in year 4, so I actually went into hospital and saw lots of patients who had had heart attacks, and I learned then from that. And it's about putting it all together. So one of the nice things about medicine is you're constantly kind of building up this knowledge where you're building upon things rather than just learning things once. You definitely build on things rather than having to kind of go back to lectures and things. How difficult is a medical degree compared to a degree in another field? Right, so this is what I wanted to talk about, which I completely forgot to, so thank you for reminding me. So a medical degree is not difficult if you stay on top of things. So it's not hard science. Talking to patients isn't difficult either. It's not difficult doing clinical skills. What is difficult is constantly being present in that you are expected to be in every single day, pretty much. You're expected to attend all your lectures. You're expected to go to hospital and work pretty much 9 to 5. So it's about kind of being prepared for that, having the energy for that and being on top of things. So if you don't keep on top of things, then you'll start falling behind, and that is how people fail. It's nothing to do with not understanding things. You will understand things. It's not, a lot of it is very simple, whereas in kind of A-level biology, you're learning difficult concepts and you then have to apply to questions. In medicine, a lot of it is very factual. So you'll learn the symptoms that make up a heart attack, and then you'll get a question about a patient that has those symptoms, and you have to say that the answer is a heart attack. It's not difficult at all if you stay on top of things and you go to hospital when you need to be there, you attend your lectures, you go to seminars, and if you need help, you ask for it. So that's what I would say. I would definitely say that none of my medical years have been harder than year 13, and I'm near the end now. So is there a lot of competition in this field? Yes. So medical school is notoriously hard to get into. You saw on that table I just showed you that there's a lot of applications for each place. So I would say apply strategically, but apply based on your strengths. I had a really high UCAT score, so I think it was 775, and I knew that King's really like a high UCAT score, so I applied to King's. If you've, for example, Bristol really care about the personal statement. Leicester really care about GCSE grades. So depending on your strengths, apply to those universities, because then you're more likely to get in. Don't apply to universities just because you like them. You should apply based on your strengths. You're more likely to get in that way. Why do people medicine is very hard and not many people do it? Okay, lots of people do medicine. All the places are filled every single year. Medicine is hard, as I said, because you're on the ball all the time and you have to keep up with things. The content isn't hard. Okay, I'm just going to move on to UCAT and BMAT because someone is asking about that. So the UCAT, Up here is a screenshot of Medify, which is an excellent resource for doing UCAT questions. It's one of the entrance exams for medical school, and it's the most important one for most medical schools. So most medical schools require it. It's, as I said earlier, it's about finding patterns. So this, for example, this question is one of the non-verbal reasoning questions. There are 5 different sections for it, and the best way to learn how to do the UCAT is to practice in the summer before your UCAT. And when I say practice, really practice, focus on it. And I would say you need to do about 3 or 4 weeks of kind of just UCAT. Keep doing questions, keep reading the UCAT books and build yourself up. And you'll reach a point where you kind of get to your peak, and that's when you should be doing your exam. With the UCAT, it's not something that you need to do the year before. It's not something that you need to do over a couple of months. Most people do intense kind of training for it over a couple of weeks. And again, there are lots of MyTutor tutors that will help you with that. There's lots of resources online. This book, the 1250 UK CAT questions, is one of the most popular. There's also the CAT plan book, but there's lots of different books. What I would say is start off with books and then go on to online questions, because the exam is online. So you need to be able to do the questions online. You need to be able to use an online calculator. So you need to build yourself up. The BMAT is a paper exam, although I think it might be online this year. It's all science-based pretty much. And there's one essay section and one section which is kind of about finding patterns, but it's more of a cognitive reasoning section. This is good if you're doing or you've done GCSE physics, biology, chemistry, and maybe even A-level physics, because they'll have all 3 sciences in the exam. So it's less about kind of new skills. It's more about kind of the knowledge you already have and writing essays. And as I said, only a couple of unis want that. All universities are good for medicine. How do I stand out when applying and writing statements? Look at what your university wants, or the university that you're applying to wants. That's what I would say. Is UCAT BMAT after A-levels? So the UCAT you do in the summer of year 12, so after AS, and the BMAT you do after you've applied, so it's usually November time. Okay, so my final slide, I think it's my final slide, is on interviews. So this is kind of the last stage before you hopefully get an offer. And what I would say, or what this slide is trying to tell you, is practice, practice, and practice. Practice with lots of new people, practice with people you know, practice using tutors, practice with your teachers, practice with friends, family. You need to try and get as many people asking you questions as possible, because you won't know the interviewers. It will be really hard to communicate with them. You'll be nervous. So if you can practice with people you don't know, that's going to start getting you kind of experience talking to people when you're nervous. And the other thing is, look at what type of interview the university that you're applying to wants. So as I said, some people do multiple mini interviews, so MMIs, which is what King's did, Birmingham did that. Southampton had a panel interview, UCL do a panel interview, and some universities don't have any interviews. So I think it's just Edinburgh now. So definitely look at what your university is requiring and then go into looking at what they want. So for example, at King's, they care so much about communication. They care that you can show empathy, that you can communicate well with people, that you can show kind of skills. So for example, one of my stations was a picture that I had to explain or describe to a blind child. And it was really difficult. So things like that, you're only going to get from experience of talking to people you don't know, and also from looking at what Kings are looking for. So I knew already that Kings are always looking for communication, and that's a classic communication station where you have to show that you can communicate to people that can't see, and also a child as well. Do you do the UCAT on the internet? So usually you do the UCAT in the driving test centre. Not the driving test, I'm sorry, where you do your, what's the exam called? You know, the exam that you do before your driving test, the online one. I've now forgotten the name of it.
Theory test.
Yeah, that's it, the theory test. The theory test, where you do that, that's where you do the UCAT. What is the difference between medical school and medical universities? Most universities that have medical schools are also medical universities. So, okay, so there's no universities that are just medical universities. So for example, King's have many different degree choices, but they're also a medical school. So our medical school is called GKT. At UCL, they have a medical school as well as offering other degrees. Do you have to do both UCAT and BMAT? No, it depends which universities you apply to. Is there a competitive, unfriendly atmosphere among medical students? I'm really happy you asked that. So there can be, is the answer to that. I've not found that at King's. I've actually found that it's really friendly at King's. And I think that was mainly one of the reasons why I chose King's, because I know it's not one of the, if you want to say, most competitive London unis. And so I think there's not as much competition there. But I know that some of the other medical schools or medical unis do have a lot of competition, and that can make it an unfriendly atmosphere. But it just depends who you make friends with, and don't let that get you down. Medical school is really fun. Why are the interviews and confidence really important? Because at the interview, you have to explain why you should be a medical student and why they should offer you a place. So it's about putting that across to your interviewer, or sometimes multiple interviewers, and explaining to them that you are actually going to make a great doctor in the future. If you don't get into medical school the first time, when can you retake the UCAT? So you have to retake it basically the summer before you apply again. Unfortunately, you can't carry forward your UCAT result. You have to retake it the next year or 2 years later, depending on when you apply. Okay, are there any last questions before we finish? So I know we're out of time. Hopefully I've covered most of the things. Someone's asking, so I am not currently tutoring because I'm way too busy at medical school at the moment, but there are lots of different interview practice tutors on MyTutor. If you fail your UCAT, can you retake? Not until the next year, unfortunately. You can't really fail your UCAT. It just means that you get a lower score. So then if you do get a lower score, apply strategically. There are some universities that don't really care about the UCAT. They make you do it as an entrance kind of requirement, but they don't really care what score you get. So again, you just need to apply strategically, use the medic portal, to have a look at which universities they are. Do you get homework? No. So your homework is basically kind of going over lectures, learning the content. Sometimes in year one specifically, when we had seminars, we would have work to do before a seminar. But since then, not really. You don't really get homework. Are there set questions in the interview? Panel interviews, yes. So a lot of the panel interviews, like things like, why do you want to study medicine? Why have you read this book? If it's in your personal statement, for example, what did you learn from this experience? MMIs, not so much. They tend to be very different questions, but you can predict what type of stations might come up. When did I realize what I wanted to specialize in? At medical school. I kind of knew beforehand because I really liked my GP and I liked what she did. But in medical school, I've had a lot of general practice placements, and they've been my favorite placements. It's where I learn the most, it's where I get to kind of talk to patients the most and actually kind of feel like a doctor, even though I'm not yet. What is the passing score for the UCAT? There is no passing score. Most students try and get above the 50th centile. So if you imagine you've got 100 students doing it, you want to be in the top 50, basically. How do you revise at medical school? I think I've already answered that, but essentially it's about learning on placement, learning from your lectures, learning from seminars. It's very different to year 13 or A-levels. What is a Professor George Prize? Okay, I'm assuming you've just looked me up. So a Professor George Prize is a prize I won for some prescribing research I did. So you can win prizes at university through research, through getting good grades. There's lots of ways to win prizes. And yes, they do make you stand out, but sometimes it's also just about showcasing your work. Did you always want to study medicine and become a doctor? Yes. As far as I can remember. Yeah, when I started secondary school, I knew from then that I wanted to study medicine. Best way to prepare for an MMI, practice. The answer for all interviews is practice, and you cannot go wrong with practice. I don't think I practiced enough. You definitely just need to keep practicing. Start practicing early, predict that you're going to get interviews, even if you've not been offered an interview yet. So for example, for my King's interview, because I got a high UCAT score, I was actually on the first day of King's interviews, which did not work in my favor at all. I wasn't expecting my interview to literally be a week later. I had been preparing, but not that much, because I expected my interview to be in January, and it was pretty much December, beginning of December. So prepare for interviews to come early, prepare for lots of different types of interviews is what I would say.
Okay, great. So I
that's
think
all.
we're going to have to stop there. But I think we can all just say a huge thank you to Amin for her incredible and insightful insights into medicine. I think we can all agree it was really interesting. If you guys have more questions or would like to watch this back, it will be uploaded onto our YouTube channel, the MyTutor YouTube channel at the end of today. And yeah, thank you all for coming. And again, a massive thanks to Amin for all her hard work. All right then. Thanks everyone. Bye.
Bye.